Good evening. Today is April the 22nd, 2018. My name is Christy Paul, and we have
EP.
EP. Okay, and we are here to do a complete head to toe assessment on you, Mr. EP. Okay.
Okay.
I just want to remind you that we are in a private setting, and everything that will be discussed and found within this assessment will be strictly between me and you. Okay.
Okay.
Okay. And I may be writing certain stuff down throughout this whole process, but it doesn't mean I found anything negative. It just so I have to report some of my findings. Okay.
All right.
Okay. Any questions, concerns, or thoughts before we
No.
start? Okay. All right. Well, first let's talk about the actual skin. Okay. Let's talk about skin. I see your skin is appropriate for your ethnicity. I see it's intact. I'm looking at the arms and the legs as well, okay? It's intact. I don't see any type of bruising, lesions, ulcers, marks, scars, or anything of that nature, any type of swelling is anyway, okay?
Okay.
And also, I'm looking at your head is proportionate to your body. It is, it looks round and symmetrical, okay? Your facial features as well. I'm looking at your eyes, your eyebrows, your eyelids, eyelashes are evenly distributed amongst the eyelids. I'm looking at your lips as well. Your lips are the same color as your ethnicity, okay? And it's kind of gray, and it's not cracked. I don't see any lesions, any type of bleeding, anything like that, okay? So right now I'm going to get ready to actually place hands on you. Palpate your head, okay?
Okay.
I'm going to use a little bit of hand hygiene, okay?
All right.
I'm going to stand up here. I'm going to palpate Mr. EP's head. I don't feel any type of dents, crevices, any type of lesions. Do you feel any type of pain or tenderness at all?
No.
Okay. I'm looking at EP's ears symmetrically. They're intact. I don't see any type of broken skin, any type of lesions, ulcers, any type of discharge. I'm looking at the tragus as well. It's not swollen or anything. Do you feel anything when I palpate on it?
No. No pain.
No pain? Okay. Just slight pressure,
Yeah.
probably. Okay. I'm going to look at Mr. EP's, I'm going to feel Mr. EP's sinuses, his frontal and his maxillary sinuses, okay? Kind of bend, thank you. All right. Did you feel any type of pain at all? Any type
No.
of discomfort and tenderness when I did that?
No.
Okay. All right. Right now, I'm going to feel your TMJ joint. TMJ is the joint that you open and close your mouth. It's the type of joint, the temporal mandible joint, okay?
Okay.
All right, open your mouth like this and close it, okay? I didn't feel any type of clicks. Was that painful for you?
No.
Okay, good job. Do you have any questions, concerns, thoughts so far?
No, ma'am.
Okay. All right. Open your mouth for me. I'm going to look in Mr. EP's mouth and I'm going to see if I see any type of broken skin, any lesions, ulcers on that buccal mucosa. I see it's pink and smooth and intact. Stick your tongue out for me. The tongue is
Uh,
midline. I don't see any cracks or anything within the tongue. Okay, you can put your tongue back. Okay. Do your mouth like this. I just want to see your teeth. Okay. I'm looking at Mr. EP's teeth. They're white in color. They're straight. They're evenly distributed And in the mouth, I'm looking at the gums. The gums are intact. I don't notice any bleeding, any type of swelling within the gum line. Okay. Um, do you have any issues swallowing or anything like that?
No.
Okay. Well, right now, let's go back and do the temperature. Let's check for temperature, okay, on your body, okay?
All right.
I want to just do just like this for me with your arm. EP's skin is very warm to touch. All right, I'm looking at the lower extremities as well. Feeling the lower extremities, very warm to touch. It's dry in nature. And let's do the skin turgor. Skin is very elastic. It doesn't stay up, which means that would mean it's tinted. And there's no tinting present. Alright, we're going to check the capillary refill and the nails. That's to see the good blood circulation, okay?
Okay.
Alright, capillary refill is less than 2 seconds. I'm going to check the feet as well, okay? Can you stick your feet out for me? Okay. Are you okay?
It tickles a little bit.
Alright. So I'm going to check your thyroid and your trachea, okay? I need you to switch positions for me.
Sure.
Have a seat. I'm going to go behind you.
All right.
Sit back. Kind of extend your neck out like this, okay? And I want you to swallow. Alright. I felt the thyroid going up and down. I does not feel enlarged. No swelling at all. Alright. Swallow again for me. Swallow again for me. Alright. I felt the tracheal midline. It doesn't deviate at all, okay?
All right.
Alright. You can have a seat back over there for me.
Sure.
We're going to take a closer look at your nose, okay? Any problem swelling? Any problem smelling at all?
No.
Alright. Right now I'm just looking at the nose. Can you hold your head up for me like that? Looking at the septum part of the nose. The septum is a little wall that separates the nares, the two nares that you have. I don't see that it's deviated at all, okay?
All right.
I'm going to look in your nose. Are you okay? Alright. I see your mucosa is pink in color. There was no actual, the septum was not, the septum is intact. And I need you to close one nostril for me.
Okay.
Just breathe out. Breathe out. Okay. Go to the other nostril and breathe out for me. Alright, that's checking for nasal patency.
Okay.
And it looks to be good on your end, okay?
All right.
Alright. Any type of questions, concerns, thoughts you have so far?
No.
Okay. I'm going to actually tell you to open your mouth again. Stick your tongue out. And I'm going to use this Lean your head back. Stick your tongue out. Say ah.
Ah.
Alright. Your tonsils were intact. You have tonsils on both sides. They're like a +2, which means it's normal in size, okay?
Okay.
There's like a little ball in the back of your neck, the uvula. It was not swollen. It was just hanging down. It's pink, okay?
Okay.
All right. Any questions, concerns, thoughts so far?
No.
Next, we're gonna test your hearing, okay?
All right.
Um, any problems hearing at all?
No.
We're gonna do a whisper test.
Okay.
I'm gonna whisper some things to you. I want you to repeat it to me, okay?
Okay.
Sit back. Close, close your ear with this. There you go.
AB4.
Okay. Repeat this side. There you go.
YZT.
Okay. Next, we're going to do the Weber test. The Weber test, I want you to tell me when you stop hearing the sound, okay?
Okay.
This is a tuning fork. I'm going to put it on the back side right here, the mastoid bone, okay?
Okay. I don't hear it. I don't hear it.
Okay. All right. Let's do the Weber test, okay?
Okay.
Let me know if you hear the sound in both ears, okay?
Okay. Yes, I can hear it in both ears.
Okay. I'm going to feel the mastoid bone. Mastoid bone feels symmetrical. The same on both sides, okay?
All right.
I'm going to also feel your lymph nodes, okay?
All right.
Come a little closer to me. I'm going to feel the lymph nodes on this side as well.
Okay.
All right. It didn't feel movable at all. Well, it feels slightly movable. I didn't feel any type of buildup at all. They're small. If it was buildup, we would suspect drainage issues, okay?
Okay.
But everything seems to be within normal range. Did you feel any type of tenderness or pain when I pressed down on your lymph nodes?
No.
Okay. All right. I'm going to look in your ears now. Have you noticed any type of discharge at all coming from your ears?
No.
Turn your head to the side for me. This side. Okay, I see your eardrum. Your eardrum is pearly white. kind of silvery clear. Okay.
Okay.
It's not bulging. It looks kind of smooth. I did see a little bit of wax build up. Do you have a little bit of wax issues?
Yes, my ears produce a lot of wax.
Okay. And how do you clean that out?
I use Q-tips.
Okay. Not too far in your
No.
ear, I hope.
No.
Okay. Okay. Next, we're going to look at your eyes, okay?
Alright.
Right now, I'm just looking at the position. If you look at me, I'm looking at the position of your eyes. They're symmetrical, evenly shaped. They're not bulging out. They look moist. So no type of dry eye issues, right?
No.
Okay. I want you to follow this pin light only with your eyes, okay?
Alright.
Have your head straight for me when you do it. Thank you. Okay. That was the sixth cardinal gaze, and you did great with that. Okay.
Alright.
And we're going to just look at the brows, the eyelids, the eyelashes. Like I stated before, they look all within normal limits. Um, let's look at your actual pupils. I see they're round. They're brown in color. Um, open your eyes real wide for me. All right, they are reactive to light. So I would say the pupils are equal, round, reactive to light, and they do accommodate. Okay.
Okay.
Um, we look at the sclera. The sclera is white in color. Please look at me. Your sclera is white in color. No type of redness going on with the sclera. Okay. Your conjunctiva. Let's look at that. Open your eyes for me. It's pink. No type of discharge, anything like that situated, okay? I'm going to press down on your tear ducts. It's called the lacrimal structures, okay?
Okay.
No type of irritation, anything like that at all going on with that?
No.
Okay. All right. No type of redness or tenderness, right?
No.
Okay. Alright, we're going to test some visual accuracy with your eyes, okay?
Alright.
Using the Snellen chart. I want you to read the bottom half for me. You can use your glasses if you need to.
No, that's fine. It's LTFTH.
Okay.
CFEHJ.
We're on the third line from the bottom.
EPTVO.
Okay.
BHJBS.
Fifth line from the bottom.
OLCF.
Alright.
FTH. LT. And E.
Awesome. You did great with the Snellen test, okay? Right now we're going to do the cardiovascular portion of this exam.
Okay.
I do need you to take off your shirt. Okay. Put your shirt over here. And I need you to lay down for me. So right now I'm looking at just for any type of heaves, any type of pulsations on the chest area, in particular the pericardium, and I don't see anything that would stand out. And right now we can even look at the abdomen. The abdomen has a rounded contour to it. Any type of issues you have with GI, any type of bowel movements you may have,
Oh, no.
issues with that area.
No.
Okay. All right. Right now we're going to listen to some heart sounds. So I just listened to some heart sounds, the aortic, pulmonic, Erb's point, tricuspid, and mitral valve, and they all seem to be within working order. Um, I did hear S1 and S2 normal heart rates. Okay.
Okay.
Okay. Can you turn your head to the side for me? I don't see any type of jugular vein distension on your neck. Turn to the other side for me. Okay. No type of visible bulging of the jugular vein that I have noticed. Okay. I'm going to auscultate for the car the carotid artery and also to his abdomen, some vascular sounds as well while I have him down on the couch. Okay? Can you turn your head to the side for me? Okay? All right, listen to the carotid artery, the renal artery, the iliac artery as well, and the renal artery for the abdominal area. I didn't hear any type of bruise at all in none of the arteries. I did auscultate for balance cells as well, and they do seem active. Any problems with your appetite at all? You want to report? Okay. Um, I see your effort to breathe is very easy. You're not in any type of distress to actually breathe. Okay. Um, right now, while I have you down on the couch, I'm going to go ahead and percuss and palpate your stomach, okay? Which means I'm just going to feel in your stomach for a little bit, okay?
Okay.
I'm doing some light palpation on the abdomen area. Let me know if you feel any type of pain or discomfort, okay?
Okay.
That was the light palpation in all four quadrants. Right now I'm going to do the deep palpation. All right, I'm going to try to feel the liver too, okay?
Okay.
The hand above, there you go. Inhale for me. Exhale. Okay. I couldn't quite feel the liver, but you did get to see the actual technique. Okay, so right now I'm going to have you sit up for me.
Okay.
Thank you. All right, kind of have your back towards me, okay? Put some more hand hygiene on. I'm going to test to see if there's any pain in your kidneys, okay?
Okay.
As a matter of fact, kind of turn this way for me. Turn the other way. And I'm going to stand up. Any type of pain at all?
No.
Okay. And now there you go. I'm going to put my hands together like this, the thumbs. And I want you just to breathe in for me. Awesome. Breathe out. Okay. The thumbs did separate when I did that, okay? When EP did breathe out. Breathe in. Okay. So right now we're going to do the tactile affirmative, which I'm expected to feel a particular sound when I do this, okay? And I'll let you know if I feel it, okay?
Okay.
So right now I want you just to say 99 in as clear a voice you can, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99.
All right. I did feel vibrations when the EP was saying 99, okay? You doing okay so far?
Yeah.
Okay. With the abdomen, I didn't see any type of scars, lesions, ulcers, and like anything like that, okay? When I was looking at your abdomen, your umbilicus, your belly button is in, and I didn't see any type of protrusion, which would lead me to believe, maybe a hernia or something that you would probably have, okay?
Okay.
Okay. Did you have any questions, concerns, thoughts?
No.
All right, lay back for me. I'm going to percuss for a particular sound in your abdomen, okay?
All right.
You okay?
Took over a little bit.
All right, I didn't hear anything out of the ordinary when I was percussing the abdomen, okay?
Okay.
And also there is another artery with your abdomen called the femoral artery that I will not hear with the stethoscope, but I did wanted to verbalize that I would normally do that, okay?
Okay.
All right, sit up for me. All tell me your name?
EP.
What's today's date?
Today is April the 22nd.
Okay. And what time is it?
Around 5 o'clock.
Around 5 o'clock, okay. And where are you at right now? You're
It's a private center.
okay. A private center, okay.
A private setting.
Setting, okay. All right. Just by you answering those questions, it shows me that you're alert and orientated. Times 4, okay?
All right.
You know who you are, you know what time it is, what day it is, why you're here, and why you're here, okay?
Right.
Okay. Right now, let's just look for, let's just do your cranial nerve assessment, okay? I'm
Okay.
going to be tested for certain senses within cranial nerves, okay?
All right.
All right, close your eyes for me. I'm going to put a certain thing under your nose. I want you to be able to let me know if you smell it or not, okay?
Okay. Smells toothpaste.
Okay, great job. Continue to keep your eyes closed.
Okay.
Close one nostril for me. Close the other nostril, okay? What does that smell like?
Oh, some type of soap or dishwashing soap or some type of soap.
Okay.
Dishwashing liquid or something.
All right, that sounds about good to me, okay?
Okay.
We did have you read from the Snellen chart earlier, and that tested visual acuity, the optic nerve as well, okay?
Okay.
So what I want you to do is let me know when you see this object out of your peripheral vision, okay? So keep your eyes straight for me. Let me know when you see this object,
I see it.
okay? Let me know when you see this object,
I see it.
okay? The test of your peripheral vision, okay? We also already talked about your extraocular movements when we did the 6 cardinal gaze, okay? Right now, I want you just to do your trigeminal nerve. Let's test for that. So clench your teeth for me. Okay. And right now, I want you to smile. Let's smile. All right. Frown for me. Kind of puff out your cheeks. Okay. Great job. And we already did somewhat of the, when I told him that Mr. EP to have his tongue out, that was the hypoglycemial cranial nerve that was tested. And we also did the gag reflex with swallowing as well. So right now, let's do the spinal accessory nerve. Let's test for that. So I'm going to apply some resistance with your shoulders.
Okay.
And I want you to just try to hold them up, okay, but not push it down.
Okay.
All right? Okay. All right. And I want you to push your head against the force, okay?
Okay.
All right, let's do this. Very good. Very good. So right now we're going to do some grips. Grip my hand. Grips is strong bilaterally. And let's do the Bambinsky. Hold your foot up. Okay, put your other foot up for me. Okay, that was negative. Very good. Let's do some pulses as well, okay?
Okay.
So right now I'm going to feel your pulses. I'm going to feel your temporal pulse. Can you come closer to me? Temporal pulse. your carotid pulse one at a time. Hold your hands out like this. Your brachial pulse. Radial pulse. The femoral pulse is another pulse as well, but we will not palpate that, okay?
Okay.
Alright. Let me do your popliteal pulse. Alright, let's stick your feet up again for me. This is the dorsal tibialis pulse. And this is the dorsal pediis pulse. This is the dorsal tibialis pulse. Do your other. Okay. So right now I'm just looking at your shoulders. Your shoulders are evenly aligned. There's no type of swelling, it doesn't look to be dislocated or anything. Do you have any problems with any of your joints at all?
No.
Okay. Alright, I want you to do your head like this for me. Just rotate your head like this, okay? Look, don't close your eyes while you do it. Just look at me, please. Alright, move your head like this down and then slowly up. And then from side to side. Okay? Alright. Just stand up for me from your shoulders. Come over here so the camera can see you. Do like this for me. High as you can. Then go down. Very slowly. And then go to the side and pull them back like this. Okay? And go to the side like this. Any type of discomfort at all you're feeling?
No.
Okay. Let's do like this for me. Let the camera see you. And do just like this for me. Slowly but surely. Do it again for me. All right. Any type of discomfort you want to report?
No.
Well, let's stand up. Let's stand up and let's do the knee flexion. And do your other knee. There you go. All right, you're going to lay down for me. You're going to do your legs, okay?
Okay.
Put your leg all the way up for me. Okay, put it down. Put the other one up. Put it down. All right. Put it up and out. You just do the other leg because you're on the couch. Up and out. Up and out. Let me help. There you go. Very good. All right. Bend it and pull it in for me. Put it in towards your body. Very good. Very good. Okay. Sit up for me. You're gonna do your ankle. Do your ankle. Do it just like that. There you go. And then do it the other way, much as you can. Okay. Let's do your hand. Okay. You have any questions, concerns, thoughts thus far?
No.
All right. I'm gonna hold your hands up like this. I'm gonna push. I want you to kind of push against me, okay?
Okay.
All right. And do your legs the same way, okay?
All right.
Okay. All right. Let's stand up. Let me do your spine as well. Turn around for me. All right. Bend over. All right. Sit up. Stand up. Okay. We're going to go around over here to this side over here. We're going to do some reflexes, okay?
Okay.
Well, before that, let's go ahead and do the tandem walking. So, okay, turn around that way and do it. All right, very good. Now I want you just to stand in one spot with your feet close together. All right, apologize for that. Stand in one spot with your feet close together and your hands close together too. Okay? Now, close your eyes. That was the Romberg test. I didn't see any type of swelling at all going on, no type of swaying, I should say. All right, you did pretty good with that. All right. Have a seat for me. We're going to do some reflexes now. No. Look, that's fine. Have a seat right here. This is the brachial reflex, okay? Okay. This is the brachial radial reflex. All right. This is the tricep. Just relax your arm. Relax your arm. I'm going to do it on this side as well. Okay. We're going to do the patella. Okay. And we're going to do the Achilles one. This is the last reflex we're going to do. Okay. Any questions, concerns, thoughts you have so far?
No.
All right. Muscle strength was like on a grade 4,
Okay.
and your reflexes were good. Your range of motion was pretty good as well. No tenderness or swelling was noted by you. Any other questions, concerns, thoughts you may have?
No.
Well, okay, I think that does conclude our physical assessment on EP. We went a little bit over our time, about 40 seconds or so, but we did make it.
All right.
And you have a good day, okay?
You too.
All right, thank you.
All right.